So, Petra, I'm going to hand over to you now to just give your presentation.
Thanks, Heather. And I'm delighted to be here with you today, albeit part of an experiment, which is slightly concerning, but hopefully a very ethical and consensual experiment. And I do hope that some of the things that I hope to share with you today turn out to be useful for all of you in your various organisations. I'm very conscious that we have a broad group of individuals with us today who are related to a whole range of organisations across the sector. And you are all impacting and making a big difference in your areas. So if there's anything that I can offer in terms of perspectives, I do hope that's of value today. I'm delighted to be able to share some of the perspectives from psychology on how we can support effective work in these really difficult and, I suppose, unprecedented times is almost an overused phrase nowadays, but they are indeed unprecedented times. And I suppose if there are some perspectives from psychology that can be of value and of use within your organisations, I'm pleased to be able to share those with you today. It's a very weird phenomenon to be sitting here in my office speaking to my computer. However, increasingly I have become more adept at it. My computer is a very good partner in crime. It doesn't speak back to me. But that does mean then that it can be a bit problematic in terms of getting feedback. So it's good that we have an opportunity at the end for any comments or any reflections or any of your own experiences that you want to share and think would be of value to other participants on the call. I'd be very happy to hear those.
So Petra, I should probably have said if people want to make comments, we can use some of those. If folk want to put them in the chat function, we can keep a wee eye on those.
Absolutely. Okay, I'm hoping that you can all see the first slide. So we're moving on, and those of you of a certain genre, such as myself, and I'm hoping there's not too many that don't recognise this. This is Dorothy, and sometimes I think I feel a bit like Dorothy. I look around and I think, where am I? I think I've landed in a world that I don't recognise in a time that's very different, and Dorothy's wide eyes are certainly indicative of how I feel on a regular basis. I sometimes wake up in the morning and hope that it's all gone away, and it hasn't. And I suppose my naive hopes that the middle of June, when the 12-week period would be over, we're actually going to see the virus having disappeared and the world return to normal, has been proven to be a naive hope. So I think...
Petra, can I just ask, Dim, you can't see the slide. Can most other people see the slides? Could you just nod? Yeah. Let me see. Yes, yes, yes. Mostly yes. Okay. Jim,
okay.
Slides after for colleagues haven't.
Apologies, Jim. Hopefully it'll come online for you. I suppose as we moved into the early stages of the recognition that we were in a very serious illness that was impacting our society, our systems, our healthcare, we began to think about, well, actually, how do we support the well-being needs of our health and social care workforce during this time? And we recognised that actually what was being asked of staff in terms of the flexibility, the changes in roles, the need to work in very different ways, was a very significant ask of staff at this point in time. So we brought together a group from in particular psychologists, but also other colleagues from health and social care, from across each of the trusts in Northern Ireland, from the PHA, from the board, from the Leadership Centre. And together we looked at developing a framework based on the British Psychological Society guidance as our foundation, which would help us as providers, as leaders, as managers, and as organisations to think about how we support the health and well-being of our staff at this really challenging time. And alongside that framework, we developed a range of resources, and those resources and the framework are all shared in the PHA website, and I will give you the links to that later on, and the presentation will be shared with people if that's of any benefit to you. So Heather's in a position to share the presentation. The resources have been developed by a group of psychologists, and they focus on looking after yourself, looking after your teams, looking after children and young people, people with disabilities such as autism, looking after your family. And the resources, I suppose, There's quite a broad range of resources in recognition that actually people need different things at different points in time. So I would encourage you, when you get the link, to go in and have a bit of a hook around, to look and to see what feels good for you, to try things out. There's a couple of lovely visualizations, and there's some nice posters that can be used with staff and with teams, and some advice sheets and so on. So I would encourage you to go and have a little delve about on the PHA website on the link that I share at the end of the session. And as I say, those have been developed by a broad group from across the whole of Northern Ireland, including colleagues from clinical psychology and others. The leadership framework, as I've mentioned, is very much a short and easy to read document, which provides us with a values-based and our health and social care values. You'll see noted there at the bottom of the slide. Very much based on those values and based around a set of principles for how we would work and how, as health and social care staff and as leaders within health and social care staff, we would want to provide our care to our staff and to our staff that we contract with more broadly. The approach looks at a number of phases that we expect to see, and I'll have an opportunity to share those with you. And hopefully you'll recognise some of those phases as we go through the presentation, and also to think about the staff responses at each of those phases and our responses as organisations to our staff. And then, as I mentioned earlier, there's the development of helpful organisational resources and responses. Okay, so many of you will recognise Maslow. If ever there was a guy that really everybody has heard of, and his approach, Maslow's approach, is really very helpful at this time, because as all of you know, and as all of you will be familiar with, Maslow recognised and helped us to recognise that actually there's a hierarchy of needs, and in particular if our physiological needs at the foundation of the pyramid are not met, so our need for safety in particular at this point in time, are not met, it's very difficult to proceed through the other levels within the hierarchy of needs. So it's difficult for us to experience any belonging or any growth in self-esteem or any self-actualization, creativity, for example, without having the foundation blocks in place. So when we think about our staff, we need to think about how we make sure that they have access to adequate arrangements for sleeping. So you'll have seen some of the arrangements around getting access to accommodation for health and social care staff, access to food. So there's been some free food and free drinks offered to health and social care staff across trusts in particular, and so on, in recognition of the need to meet the physiological needs of our workforce at this point in time. So in this current challenging context, if physiological needs are not met, we can't progress, and our staff will not be able to feel safe and secure and to move beyond that. So therefore it's really important for us to think that through, and then to apply that across and to think about our teams and the dynamics within effective teams. And again, a very hierarchical approach can be helpful in simplifying this, but to think about the importance of psychological safety. So based on Maslow's hierarchy of needs, there's a hierarchy of dynamics that create and support the development of effective teams, and we can pick up on that as we go through the presentation. But really looking at the importance of psychological safety and dependability as foundations, the need for a sense of belonging, the need for meaning in the work that we do, and to understand the impact of what we do and to create an impact. So the importance of each of those levels, and each being built upon from other levels. So the key elements of the team resilience that we're going to think about today are really the development of psychological safety and dependability, of belonging, of meaning, and of impact. And so does psychological safety matter? Well, Edmondson has said that as long as there's uncertainty and interdependence, psychological safety will be important. And if ever there was a time of uncertainty, it's certainly at this point in time. So it's really crucial for us to think about psychological safety, so not just physiological safety of our staff and physical safety, but also psychological safety. So we must build on the physical safety and the need for physical safety by developing psychological safety for our staff before we expect them to progress and to move on to new and challenging roles and to stretch themselves, to learn new skills, and to support others with generosity of spirit and kindness and compassion at this point in time. So the very underpinning levels of all of this are our physical safety and our psychological safety as foundations. So when we think about the multitude of issues that our staff face at this point in time, there's endless issues and concerns being brought to us, and I'm sure many of you will have heard many concerns on behalf of your staff about the challenges of disconnection, for example, from others by virtue of working remotely. We have cohorts of staff who, based on their physical status and their need to be at home, are at home shielding and really experiencing significant difficulty in not being able to be out and about and having access to exercise and the implications that has on them. So the disconnection from others is significant. Even the disconnection of actually doing a presentation like this, whereas generally we'd all be together, we'd be in a room, there'd be a humdrum, we'd be having a sense and an opportunity to have a chat amongst each other. That disconnection that we experience is very significant. We also have many staff who have anxieties about their own safety, their own health, their own well-being, that of their family and their friends, that of their staff, their colleagues. We've imposed narratives. So within health and social care, we're currently being held up as heroes, and there are many individuals who feel that some of the services that are being provided are not how they may want to provide services, and they're feeling challenged and feeling a sense of moral injury around that. So some of the imposed narratives from within the system, and equally the challenges from within families. So someone who comes to work and whose family struggle with the fact that they're at work and that they're in a situation of increased risk potentially to themselves. And those challenges can be very difficult for individuals. So there's a broad range of issues that face many of our staff at this moment in time. And those issues can be associated with uncertainty, with fear, with stress, with a sense of helplessness, with a sense of burnout, and potentially with some degree of moral injury or moral distress. And that's very challenging for us as leaders and managers within organisations to think about how do we support the broad range of individuals who actually are so crucial to our ability to deliver if they're experiencing these levels of stress. And then how do we manage ourselves? Because what issues do we face at this moment in time? And in actual fact, we face all the same issues. You as leaders, you as key individuals within your organisations face many of these issues, and I'm sure when you think about it, there'll be some of those little blue and navy circles that will actually resonate with you as being the individual issues that are of significance to you at this point in time. The strains in your capacity, the concerns that you have about the future of your organisation, your future contracts, your ability to be able to engage in a very open and transparent way in these difficult times, and to have the relationships when actually there is the disconnection from others. So how do you have the difficult conversations at this point in time? So as leaders and as senior individuals within organisations, your staff are facing these issues and you're also facing these issues. So there's a whole multiplicity of concerns and issues across multiple levels that we're all attempting to face at this point in time. And it presents a significant challenge for us. So I suppose I'm keen that you have an opportunity to reflect a little bit today and to think a little bit about what you're having to do or not do that's different for you. Think a wee bit about within that, what are you finding most challenging? And how is it for you to be managing this at this time? And also then for you to think about how you're resourcing yourself in the midst of it, in recognition that to do all of this new demand, all of this new way of working, when there are so many threats and difficulties for us, that actually we need to resource ourselves. So it's not enough for us just to think about supporting our systems that we lead, but also to think about how we support ourselves to support our systems. And I hope to pick up on some of that as we move through the presentation today. But I would encourage you to think about and to recognise and to note and to be mindful of the things that you're having to do differently and what's challenging within that and how you're supporting yourself to do all of that. Because actually the supports that we put in place are what creates the protective shield. So when we think about the multiplicity of demands and of challenges and of issues that our staff and we ourselves are experiencing, then what we can do to support our staff is to create a shield for our staff through provision of staff support. And through thinking about how best to support our staff, we can attempt to mitigate the impacts of the challenges and the difficult times and enable our staff to cope and to deliver and to do what they do as well as they can do it at this difficult time. And I suppose many of us, or all of us, work within organisations and exist within organisations where there's a whole range of different supports. And one of the things that we did when we thought about within our organisation, what we had within the Northern Trust, what we had to help us to support our staff wellbeing, was we began to scope out the whole broad range of supports that we have available to us. And there's lots of stuff that we were able to think about that we were able to draw upon and to consider to be available to us as an organisation. So not just psychological services, which are somewhat an obvious place to go, but actually our ICT team have been fabulous in the midst of this and have really helped us to remain connected. The ability to have Zoom conversations is a really helpful way to remain connected. Our trade union colleagues, our corporate communications teams, bereavement coordinators, and so on. So there's a multiplicity of services, of teams, of individuals and functions within organisations that can be drawn on to help you to think about the pyramid and how you address the needs within the pyramid for your organisation. So that's one of the things that I would encourage you to think about doing, is to scope what you have available to you in the broadest range and to think about the whole range of supports that are available and actually to recognise the value added by those supports. Again, within our organisation, we decided to take probably a fairly straightforward approach, because in my experience, the more straightforward we can make things, the better. It works well for my brain, particularly only 3 things. 3 things is really good because it's easy for me to remember. And what we decided to do was to think, well, actually, if there's 3 levels within this, then let's look and see what we can develop and what we can use to support our staff wellbeing across these 3 levels, because actually lots of people adapt really well to challenging situations and challenging circumstances, and we don't in any way want to pathologise individuals who are coping and responding very appropriately in what is in effect a very difficult and challenging time, as opposed to it being their response that is in any way challenging or difficult. So what we wanted to do was to look at, well, what resources can we make available to enable people to draw upon information that's psychologically informed, to help them to think about how they can do their jobs and provide their services in ways that really are helpful for them and for the other staff and the service users that they provide services to. So the promoting level was really about developing resources. And as I said earlier, those resources are all available to you through the PHA website, and I'll provide the link later. And it really is, it's a real treasure trove. Only a psychologist would call a list of resources a treasure trove, but bear with me, I find it a treasure trove. Lots of lovely things that can be useful for you within your organisation. Moving up a step then, we recognise that actually for some people that won't be enough. And there's some staff, there's some parts of the system that need a little bit more and need a little bit more support. And what we've thought about doing and what we have in place is consultation to some of our managers, to our team leads. We've got psychological first aid helplines which are available. We've got some drop-in services. We've got some supports to teams. We've got Schwartz rounds, which are sort of like a gathering of people together to think about important themes and to allow space to reflect. And we have some training specifically that's offered around key issues and some skills-based programs. And that works for very many people who have a little bit more need and really are struggling just to manage on their own with just resources. And then we step it up a level further, and we have what's known as the responding level. And we do have a clinical psychologist within our occupational health team, and we have an opportunity for individuals to be referred through to that individual. We have an employee assistance programme with Inspire, and I'm sure many of you in your organisations have similar, either with Inspire or with other providers. We have an opportunity and pathways to refer through to our GP colleagues to crisis support. And we also have some additional supports to teams, including team debriefs and support for teams in particular crisis, so more targeted interventions. So we have a stepped approach, and really that's recognising the resilience within the system and attempting to scaffold it as opposed to pathologise it. So I think it's really important to think about the principle of scaffolding as being something that we can take away from today. So moving on, I've got a very wordy slide. So this is the benefit of being in Zoom as opposed to being in a big room, because if I was in a big room, I'd have to apologise and take away the big slide and not show it to you. But actually we do have the opportunity on Zoom to be able to have a little look at this. And this is based on Julie Highfield, who's a clinical psychologist who works in Cardiff, in an ICU service in Cardiff, and who developed at the very early stage of this really useful resources that have been used across much of health and social care, and that help us to think about, I suppose, 3 key phases within our engagement around the pandemic. So the first is the preparatory phase, which we are through, really. The next is the active phase, and the third is the recovery phase. So on the little table that you can see in front of you, you'll see down the left-hand side the anticipatory anxiety of the preparatory stage. And we can remember that time only weeks ago now, or probably about 7 weeks ago. The planning was frenetic, the pace was high, the anticipatory anxiety was significant. It was really very challenging, and people were feeling that maybe they weren't well enough prepared. There was lots going on, and it was a very stressful and difficult time. There were many tears cried and voices raised around the country, and we all struggled with how we were going to adapt to this tsunami of difficulty that was coming to us. So the anticipatory anxiety, I suppose that's largely been and gone, so I'm not going to focus on that. And rather I'm going to talk about the other 3 columns. So the first of the active phases, there's 2 elements within the active phase. And I suppose rather than this being a very clear linear model, the model allows us to understand movement between the columns, in particular these 2 middle columns. So there's the heroics and surge to solution, and then there's the disillusionment and exhaustion. And I think probably all of us, or certainly I, recognise both sides of that, and have felt much of this through recent weeks. My word of the week 2 weeks ago was hopeless. And those of you who know me well will know that actually I'm not a hopeless or despairing person, but I felt a bit hopeless and despairing because there was a realisation that actually this wasn't going away. So actually if we pick up on the heroics and the surge to solution, there was a headiness about that phase that I can recall around. It was great working together. There was an opportunity. That was the phase when we were pulling together the resources, and it's interesting to think about even the development of the resources and the framework as being within that sort of between the anticipatory anxiety and the heroics and surge to solution phase, because we were working together, and we were working very much rising to the challenge and attempting to do the right things in preparation. There are risks within that phase as well, though, and there is a risk that people may make decisions based on instinct, and actually there is an important message for us in this to help people to remember about the evidence base and drawing on the evidence base so that we're not as prone to error and that there's less instinctive reactions. People also in this phase may witness things that they haven't seen before and feel out of control and feel very overwhelmed. And I'm going to now flick on to the next slide, and I'm going to come back to the other 2 columns of this slide. And if you look on the left-hand side, so we've dropped the anticipatory anxiety, and just additional information around the heroics and surge to solution within this slide. Here, Julie speaks about staff losing their boundaries over working hours, and I'm sure many of you can recall that and maybe still are in the midst of that phase of really working very long hours, overworking, work-life tensions rising within families, and social norms and niceties slipping. And on occasions, focus on getting things done may lead to poorer communication and more silo working. And certainly there's been some experiences of people reporting that and finding that to be difficult. And then if we go back again, just to move on to the disillusionment and exhaustion, I suppose this phase Julie highlighted as being Julie Highfield, the psychologist who developed this approach, highlighted that this is a phase of greatest psychological risk, because many staff have been busy with the anticipatory phase of building up and getting organised. They've then been busy with the long hours and throwing themselves into new roles. And actually in this next phase, the adrenaline levels are still pumping, but actually people may feel sudden exhaustion. They may neglect their physical and psychological self-care. Gyms were closed, yoga was closed down, people didn't have the opportunity to go out for prolonged periods and to do the things that keep us all well. And there is that risk that I've mentioned earlier, which is the risk of moral injury or moral distress for individuals who have found themselves in circumstances that are maybe not as aligned with their values as they would like to be, and the challenge that's associated with for them. And similarly, moving on to the middle column here, people may begin to feel emotionally disconnected from their work with some level of compassion fatigue or burnout. Again, there's been much talk about uses of avoidant or unhelpful coping strategies, such as high uses of alcohol, with people not being in work and not having the same patterns of healthy behaviours, that there has been a relaxation in some of the constraints that we would typically put around ourselves, and we almost have to create rigid rules to support us at these times. There can be tensions at home and within the wider family circle, and that ongoing stresses can lead to very low thresholds for triggering reactions and responses. And then finally, the phase that remains ahead of us, and I think that those two phases that we've just talked about, the heroics and the disillusionment and exhaustion, I think my sense is that we're moving between those phases at times, and some days we're in one and some days we're in the other. I suppose in the aftermath of all this, we will move into the recovery phase, and it's hard to know at this point in time when that will be, because actually there seems to be a very long-term tail that we're having to face into. But actually, during that time, staff will have had time to reflect. And for most people, they will have been able to cope with what has happened in their own ways. However, for some individuals, for a small number of individuals, there is a risk that they may feel that they could have done things differently. They may have regrets. They may feel that they didn't make enough of a difference, that they didn't do the things that they wanted to do, that they didn't make a contribution. They may experience that dissonance between the hero's narrative and some of the behaviours that they feel that they ended up engaged in during this process that were more challenging. And as a result of all that, they're at risk of feeling differently about their job, about their organisation, about their colleagues. And I think it's really important for us to be very cognizant that there is a risk of that in the recovery phase, and that this point in time is a really important stage to mitigate those impacts, and that we have a chance at this point in time to actually stop or reduce the likelihood of that happening by engaging fully, by communicating, and so on. So therefore, it's important for us to think about how we manage those phases and how we manage the behaviours and the experiences of our staff and of ourselves throughout those phases to help mitigate any future consequences and make it more likely that ourselves, our teams, or organisation achieve a level of recovery for the majority of people and only have very small numbers who struggle in the aftermath. So the actions that we take now or approaches that we engage in at this point in time are crucial in terms of mitigating those impacts. So I suppose it's really timely to be able to have this conversation with you, sorry, not conversation, talk at you remotely from a TV, from a computer, but actually just to prompt some thinking within yourselves around these important these important stages and the opportunity for action that may make a difference. And I suppose based on that, I thought it might be helpful for us to think a little bit about what we know from psychology about the 3 systems of emotional regulation, because Julie's model talks about the phases and talks about our experiences across the phases. But actually, Paul Gilbert's model here, which you can see in front of you, talks about 3 approaches to 3 systems that work together to support our emotional regulation. So we have our threat system, our drive system, and our soothing system. And these systems work best when they're working together in a coordinated way and are actually going in a balanced approach. And it's important for us to have balance across our 3 systems, because when 1 or 2 of the systems are out of balance, it can be really problematic for us. So at this point in time, it's most likely that across individuals, we will experience high levels of heightened threat and also potentially of heightened drive. Obviously, the threat system is activated at this point in time because there are risks to our physical safety and to our psychological safety. And our drive system can be activated as a result of the amount of learning of new tasks that we're having to do at this point in time. And we may find that these 2 systems are actually overly activated, and that our soothing, contented, safe part of our system of emotional regulation is not able to manage the demands across the other 2 systems. So actually what we need to think about is how we can rebalance our 3 elements of our systems and bring them together in a more balanced response, so that we can manage and reduce the experiences and the emotions of anxiety, of anger, and of constantly seeking to develop new skills, and can rather allow ourselves to soothe and to look after ourselves at these really difficult times. Okay, so I've largely talked through that. And I suppose then, in thinking about that, I think it's important for us to consider what does the leadership framework cover, and what does that help us to think about. So the leadership framework, again, that I'm going to send you the link to later on, and many of you may have seen already. I know Heather had sent this out some weeks ago when it was launched, when Minister Swan launched it. The leadership framework talks about the importance of visible leadership. And that's a challenge for us at this point in time, because it's hard to be out and about to do a visit round our services, to go and see people. So we need to think about that in different ways. We need to use Zoom, we need to remain connected, we need to do talking heads, to do little podcasts to our staff. So we need to think about ways that embrace technology. We need to have a communication strategy that allows us and other leaders and other individuals within our organisation to connect and to communicate with their staff. We need to support where we can a human connection and a level of peer support. So thinking about buddying systems and so on are really helpful. We need to ensure that the physical safety needs of our staff are met. We need to consider how we can normalise the psychological responses, help people to realise that these are uncertain times and that many of the experiences that they're feeling are in fact just what you would expect in a normal response to the challenge and the threat and the activation of our threat systems that we've been feeling, and that what we need to do is to consider how we can soothe ourselves, how we can take time to look after ourselves, how we can manage our constant drive to learn new skills and develop new relationships and to allow space for soothing. We need to support well-being in stepped ways. And for those who provide health and social care services, it's really important that the care that we provide to patients and to families, or for you, to your staff, to the people that you contract with, that there's a level of care within those contacts that feels appropriate and that feels aligned with your values. And I suppose the final and very important stage within the leadership framework is an acknowledgement that it's really important for you to take care of yourself because you need to take care of yourself to be able to take care of your organisation and to take care of your people, so that it can keep doing the important jobs that it needs to do. So that's just to remind us that what we talked about was the importance of psychological safety and dependability, of belonging and meaning, and of impact. And we're going to pick up on those again now as I go through the next few slides. Because building psychological safety can very readily be done. It's important to allow space for new learning in these difficult times, because actually many of us are finding ourselves in new situations, doing new things. This is a whole new world of me speaking to my little Microsoft Surface. And I didn't think, for example, to tell my secretary not to put any calls through. So you'll have heard the phone ringing, and that's my lesson for again. So my challenge and my learning for the next time is actually don't have the phone coming through. We need to acknowledge our own fallibility and our own uncertainties. We don't want to be falling apart at all times with our staff, but we do want to let them know that we have similar experiences to them. So if you remember the diagram with all the circles and all the issues, our issues were as many as our staff's issues, and our experiences are similar. We have difficult experiences. We work through the different stages of the anticipatory anxiety, of the heroics, of the disillusionment and the exhaustion, and we will all hopefully reach recovery together. But these stages are important in terms of acknowledging that they exist and to normalise the response. So build that psychological safety for staff and model curiosity and interest in how we move forward. So really our challenges are about an opportunity to learn, and they're not about failures or about difficulties that we can't respond to. So psychological safety and dependability of our leads is really important in our managers. So when frontline employees, when we think about building belonging, when frontline employees have a sense of ownership, we know that actually things happen. And on top of that, if they're allowed to take that forward, that improves. So this comes from McKinsey. So when we think about the changes that are required, there's something about engaging with our staff, and particularly, I suppose, as we move to the next phases and think about, well, how do we begin to think about a reset? How do we begin to think about the next phases? So there's something now about a different world that we're going to be creating, because we won't go back to the world of January 2020. No amount of wishing in the world will bring us back there. But there's been fantastic things that we have learned. There's been fantastic changes that we've been able to grasp and to engage with as a result of this horrendous virus, but that have enabled us to make changes that we couldn't have made in 10 years otherwise. So there is something about thinking as we move forward, how we build belonging in our organisations, within our teams, within our staff groups, and help them to think about what those changes might be and help them to drive that change forward. And that will undoubtedly help our transformation moving forward. And then
can I just say, I'm just keen to make sure we leave a wee bit of time, so it's nearly past now, just to highlight that.
I shall flick rapidly. I did tell you, Heather, I'm at risk of either talking far too long and keeping everybody way beyond, but yes, I shall talk faster.
Balance. I'm just keen to make sure that people have a chance to get some questions and contextualise it. Thanks.
Absolutely. Well, it's a very good coping strategy on my behalf because it avoids all the questions. So there we go. So moving on then to think about creating meaning, and I suppose I do think it's important to think about three builders. So I'm just going to mention this. Three builders are building a wall, and somebody comes along and chats to them and says, well, what are you doing? And builder number one says, oh, for flip's sake, I'm building a wall, just setting one brick on top of the other. You throw a bit of mortar in and you build a wall, and there you are. And the guy goes along and asks the next person, well, what are you doing? And he says, well, actually, I'm in work here, and the work that I do helps me to feed my family. We have holidays, we have a great quality of life, and that's really important to me. And the guy moves along and asks the next person, and the next person says, well, actually what I'm doing is, he says, I'm building a cathedral, and the cathedral is going to be a space where people will be able to relax, to talk to their God, to actually find peace in this really hectic world. And the three guys, in essence, were doing exactly the same thing, but they brought a different level of meaning to their tasks. So there is something for us as leaders, as organisations, as managers, to think about how we build and create meaning, because actually the enjoyment and the experience that the person who builds the wall has is very significant from the first person through to the third person. So it's a bit like the story around the astronaut of the janitor in America. What are you doing? And he said, I'm putting a man in the moon. And many of you will have heard that story, but actually the significance of recognising the meaning that we all contribute to providing a good service. So within the Northern Trust, I believe that I'm helping us to provide the best quality health and social care that we can for the people of the Northern area, and that's really important to me. And I would like to think that all of our staff feel that, and I know similarly for you, it'll be really important for you that your staff have a part of what you feel your overall vision for your service or your organisation is about. So creating meaning is really important. So I will run through this bit, but it's not because it's less important, it's because Heather will be very cross with me, and that's an even worse thing. And that's about looking after yourself as a leader and looking after leaders within organisations, because before you can lead others, it's really important to know how you lead yourself and how you look after yourself and how you tend to yourself. Because as a leader, you need to be able to deal with complex and uncertain situations while you manage your own emotions and your own actions. And you need to inspire and motivate those around you while managing their emotions and their actions. And at the same time, you have to appear almost swan-like, and you need to give a level of sense of calmness and being in control that gives them a sense of certainty, while at the same time remaining authentic. So that's not an easy task, and particularly not an easy task at all of these times. So there's something for us to think about how we prevent that falling apart, because we know that the risks when that falls apart are significant. So we need to think about self-awareness. We need to think about self-connection, self-compassion, and self-care. And I'm not going to spend long doing these because you can have a look at them yourself afterwards. Self-awareness, we need to recognise and take space sometimes to stand back from situations. We need to think about the situations that we can influence and how they differentiate from the situations that we can't either control or influence. Because actually, by worrying about the stuff in the blue circle, we're just wasting time and frustrating ourselves. We need to think about the connection to our values and our priorities, both our own personal values and priorities and our organisation's values and priorities. That self-connection is really important, in the connection to our values that underpin everything that we do. We need to be compassionate towards ourselves. We need to recognise that we're not perfect. We don't need to be perfect. And I suppose when I think about this, I think about our sat-nav, and when our sat-nav makes mistakes and makes errors, and we make errors and we go the wrong direction, our sat-nav remains very calm and clear. It provides directions, but it's not punitive. It doesn't get cross, it doesn't shout. It doesn't say, for God's sake, where are you going that direction? And when you make the correction, it leaves the issue behind. It doesn't remind you of it. So every time you're going down the road, it doesn't say the last time you did this, you got it wrong. And yet we can do that to ourselves. So we need to think how we can be compassionate and forgiving and embrace our imperfect selves and recognise that it's the best that we need to be. And on top of that, then we need to layer a level of self-care and actually not just tell other people about self-care, but actually practice it ourselves. So whether it be lying on your back, looking at the stars, and the stars were fabulous last night, whether it be doing yoga, whether it be sitting on the swing. I've got, my husband has built us a swing in the garden and it's fantastic, so it's very soothing. Whether it be reading a book, whether it be having a conversation with a friend, we need to think about the things that make a difference to us and do those things to look after ourselves now more than ever. But we also need to be able to ask and to call upon the help of friends and colleagues and professionals if need be. So be aware that there's support available and that actually engaging in that support can be really helpful. And I suppose my leaving message for you is, I think what we all need to do at this point in time is to do the best that you can until we know better what the things that we should be doing are. And then when we know better what they are, then we can do those things. So there's something about just accepting that we're doing the best that we can at this point in time. And we will continue to adapt and amend as more information comes in so that we can do the best that we can as we move forward. And I'm just going to show you the resource links there, and they'll be available to you on the presentation when Heather sends it out. So there we are, Heather. I ran through that very quickly.
No, that's great, Petra. I mean, I think there's a few people private messaging me there to say that's great and really, really helpful. So I think I invite some sort of questions or reactions, or comments. What are you doing in your own organisations, or what are the things that can help? So if you could either wave at me, I'll try and get you, or put something in the chat function. We can try and address some of those questions. And if we don't get any of those, I might even pick on some people. I have been known to do that before now. So, Jim, are you trying to indicate to me there?
Yes, indeed.
I have a question.
Okay, is it okay? Thank you.
Yes.
Petra, excellent. Thank you very much. I really enjoyed that. I have a vested interest, of course, because I have a background in psychology myself. But I have to say, a lot of that made so much sense, and quite a lot of it was new to me as well. But I think it was very powerful. So thank you very much. I have a particular question, which is that the resources you talked about, particularly in terms of the PHA and so on. I'm chairman of the PSNI, which is the regulator for pharmacists. Now, we're not a HSE body. We're an independent statutory body. So, are those resources available to us as an organisation? Very small organisation, but just with all the same psychological damage that can occur in any large organisation. And secondly, and this would actually generically apply to GPs as well, independent practitioners like pharmacists, community pharmacists working in Little Ballygo backwards, sometimes working alone, and if they're lucky they've got one shop assistant, and perhaps the odd locum. Psychological pressures in the extreme. Are those support resources available to independent practitioners as well as staff and so on in the health and social care system itself?
Yeah, Jim, I think that's a very important question. I suppose it was one of the things that came up when we were thinking through the development of the resources, and in thinking about the health and social care family, what we decided to do was to make the resources and the helplines and the supports available to all. So they're available to, so for example, they're available to our colleagues in the ambulance service, they're available to primary care, to community pharmacy, to care homes, which are very much in the fore of our thinking at this point in time, and to all partners across health and social care. So there's 5 helpline numbers within the 5 trusts across Northern Ireland.
Right.
Those supports and the helplines with a qualified psychologist at the end of the phone are all available for all of those organisations that I've talked about already. And all of the resources are also available. So all of the online resources are available, and we have partners from across primary care, we've consulted actually with pharmacy and other colleagues. So there has been fairly good engagement. We have care home involvement within that work as well, and the work moving forward, which is now about the implementation phase. So the development stuff's done. Now what we want to do is to make sure that we continue to adapt and develop moving forward.
Okay, that's excellent. Thank you very much. I mean, certainly what I want to do immediately is satisfy myself that we as an organisation are doing what we can to promote that information and make sure, because we have direct links with every single community pharmacy in Northern Ireland. So whatever we can do to ensure that pharmacists are aware that these resources are available to them as individuals as well as members of teams and so on. That's
I think
excellent.
that's right, Jim. That's what we were keen to do, is not only to
Yes,
our members to get to networks of members so that you're
absolutely.
here 2 or 3 different times.
No, I think that's very good indeed. I have to say too, just I'll not hog up the time, but I think that the point that also struck me very forcibly was that now is the time that leaders need to be thinking about the future. It's very tempting and enticing at times to get sucked into the operational big issues of the day and how do we solve that, blah, blah, blah. But actually the point you make about 6 months down the line, which members of your staff team are actually going to have problems that perhaps originated with your behavior or the organization's behavior. And I think from a leadership point of view, that's a very important point. We need to be thinking strategically well ahead and not just next week. Thank you, Petra.
Thanks, Jim. Just keen to let another couple of folk in if we have any other comments or questions.
Sorry, Heather, I have one. I posted it in the chat. Can you hear me?
Yes, I can indeed.
Petra, it's lovely to see you. It's sunny Kelsey. I work in Birmingham. My query was actually more of an observation. So one of the things that we're noticing as well in terms of the mental health and the emotional reactions is how it's affecting colleagues that would fall under the protected characteristics. So those individuals that are of a BME background or have neurodiversity issues as well. You'll no doubt be aware that what's coming through nationwide anyway in terms of the data about the mortality statistics for people of a BME background. So certainly across organisations, and the organisation that I work for, parts of our patch, our white population is actually in the minority. So it's quite a significant factor within the organisation. I just wondered whether or not you'd given any thought to how those individuals with protected characteristics can also be supported utilising the model.
Yeah, I suppose our key issue, I mean, if I pick up on neurodiversity first, within the resources, there are specific resources for supporting individuals who have issues such as ASD and learning disabilities and so on. So there was some thought given to that within the development of the model and the framework and subsequent resources. So the BME population is certainly forming part of our priority groups in the implementation phase, Sunny. So we're thinking about the needs of the BME population, and actually some of the contacts that we've had within our review of access to the helplines have been around BME populations and their expressions of anxiety and fear around the potential risk and the heightened risk to them. Now, I know there's a separate stream of work ongoing which is looking at the physical safety issues and risk stratification. And I suppose when we think about the population, we need to be very cognizant of the underpinnings of physical safety. So I think that's really important that we address those physical safety issues, and then on top of that layer the psychological support that is required and needed to those populations who are certainly much more significantly impacted. I'm also conscious of certain occupational groups. So there's a report just released today, looked at certain occupational groups as being at heightened risk, and we need to look at how we consider those groups. So bus drivers and taxi drivers and so on are at heightened risk. So we need to look at those groups as well and consider how we can make sure that their physical and psychological safety and well-being are all addressed.
Yes, Sally, thanks very much, because there's the Confed are doing a lot. There's a BME network, so again we can share some of the work that they're doing. It's a massive amount, actually. It's a major priority, so there's a good deal of work going on. So I'm just going to extend 5 or 10 minutes. Just if you have to go, please do leave. But I think I don't want to just lose the richness of the conversation as organisations try and find ways to respond I just want to check if anybody else would like to comment or ask a question. All very shy on Zoom. Anne Dixon's joined us from the Chief Executives Forum, so Anne's looking after all the public sector organisations. Hi, Anne.
Hi, Heather, and thanks for the invitation to join today's session. And Petra, thank you very much. That was a real whirlwind of really thought-provoking issues for us all to consider going forward. Our members cover the health sector, but also the rest of the public sector. So there's going to be all sorts of issues for them going forward. I think the model that you presented was really, really thought-provoking, and the idea of this phase of disillusionment and exhaustion that we probably haven't met yet, but will very soon within organisations. And I know Jim had picked up on that as well. I think that's probably one that people aren't particularly conscious of at the minute. And it's probably somewhere where all organisations will need to think about investing some sort of resource into supporting staff as they hit into that. And I'm not sure if there's a huge amount of resource ready for that at the minute, or where you would advise leaders to look for that kind of support.
I suppose my thinking at this point, it picks up a little bit on what Jim has said, is that I think there's an opportunity to act now to mitigate some of the impacts.
Yeah.
And I do think by looking at the framework and thinking about, well, what are the principles that we can adopt within the organisation, and what are the things that we can do to support visible leadership, to support communication, to support appropriate provision of connection and physical safety and so on, and actually just think those through. And I suppose I'd be encouraging people to action plan around that, because what we need to do is we need to reduce those more seriously impacted as much as we can, because I'm very conscious that in parallel with the end of this surge, there will be, or there is likely to be, a level of increased demand within mental health and psychological services more broadly, and much of the resource will be tied up in supporting the population as well as supporting staff well-being. So we need to think about how we manage to do that in parallel. I suppose I would encourage people to have conversations with their EAP providers, so your employee assistance providers, and to think about how things can be done differently, and what supports might helpfully be offered moving forward, and what supports can be put in place in as timely a way as possible. And I suppose on behalf of trusts, I will be in discussion with the Department of Health around the future provision of services and the funding that will be required to support the ongoing well-being of our staff. In the aftermath of this issue, certainly Minister Swan in launching the framework and the resources recognised the need for support into the future for our staff, who have been called upon to change roles, to take on new responsibilities, to put themselves into very challenging situations. And I know that he will be committed to supporting the longer term needs of our staff.
Cover that a wee bit more to Anne outside of today.
Sure. Yeah.
Mary McColgan is the chair of the RQIA. Mary, did you have a question you want to, or comment as well?
No, sorry. Thank you very much, Petra, for your presentation.
Very well.
In what you thought we needed to be putting in place now for the aftermath, which is very sadly coming down the line at us, and any thoughts or ideas for people who are in leadership roles, or people like myself, I'm acting chair of an organisation. Is there advice or information you would feel is important to consider?
I think we all have a responsibility to try to look after ourselves as much as possible, and to do the self-care piece as much as we can. I think on top of that, then we need to support that within our organisations, and we need to look, as I say, at the leadership framework to consider what the supports that we can put in place at this point in time to mitigate the impacts. And then on top of that, I mean, if you think back to the pyramid of the 3 levels, what we want to do is to make the pyramid as small as possible on top, so that there are as few people as possible who actually require ongoing support. because if we can normalise the experiences and enable people to cope and to use their existing networks, then that will be really helpful for people in the long run. However, there will be some people who will require support, and it will be important to make sure that we have access to dedicated, trained psychological services that can help people to deal with the ramifications of what they've experienced during this time. So I think there's something about thinking that through and thinking about how that can be explored and put in place for organisations, particularly organisations who are at risk of higher levels of moral injury and moral distress.
Petra, can I ask just how much have you been working with the HR profession? Because I mean, most organisations won't have psychological in-house support, so while there's resources there, the HR people, I suspect, are getting leaned on rather a lot to provide all this work. Are you working with CIPD or your own staff, or just could you reflect on that a little for us?
Yeah, so the astute amongst you will have noticed that I double job, so I also have the opportunity to work in occupational health, which is fantastic. It's been a really interesting part of my role within the Northern Trust. So as a result of that, that has enabled me to build links with HR colleagues, and we've also within the working groups had HR and occupational health connected into those services. So that's been really important for us. And certainly as we mainstream this moving forward, it's going to be really important for us to look at how we actually deliver our occupational health services and our HR OD supports, organisational development supports, because I suppose I see that as a bit of a spectrum of delivery, and connect across all of that in psychologically informed ways. We've also connected with the Leadership Centre, and many of you will be aware of the resources through the Leadership Centre that are supporting leaders as well, and I would encourage people to look at those resources. There's some really useful resources there.
Petra, I know we're just moving to the last couple of minutes, I know we're overrunning a bit, but could you say a wee bit, a lot of the colleagues join us are part of network organisations or influencing organisations. As we seek to move forward to reset, and the Confed's doing a bit of work on that, people who are not involved in the day-to-day grind of trying to deal with the services are taking a bit of time to think through where next and how do we springboard on the changes that have been made. But I think workforce is the first issue that you'll hear, and the second issue that you'll hear is mental health. So there are things that we can be thinking about as we seek to build back our services to build better mental health in. So it's not just about the mental health services per se, but it's about building good mental health into our populations and our communities through the services that they provide.
I think that's crucial. I think it's crucial, and it's really important for us to develop communities and connections across communities, and I suppose population health. And I'm conscious that we have colleagues who are on the line from Aware and other organisations, and I think there's lots of good work that has been occurring across a range of organisations, looking at how we can support population wellbeing, and some of the big billboard messages encouraging people to recognise when they're having difficulties, to recognise when others might be having difficulties, some of the hidden difficulties, and think about how we can support connection within our communities. And I think that's really important, because what we do want to avoid, as I've said probably earlier, is pathologising people and leading to situations where we have high levels. I'm certainly not attempting to create high levels of need for psychologists. What I would ideally like is to create systems and communities that are self-supporting and that are healthy and well, and that are informed by psychological perspectives and reduce mental health need as a result of that. Success is not having to need psychologists to do one work, because we're working at a systems level.
Yeah. So I think that's really important to reflect into that as we build. I think we probably just need to close. We're 10 minutes over. The recording from today will be available for folk. There's some points on the chat as well. I hope people can see Sarah Macon has suggested Point of Care Foundation in the care space, that storytelling narrative is a key thing as well that we can use. But we'll just keep our finger on the pulse, as it were, and if there are things that we can do to maybe explore a certain area or provide some sharing space for people or tap into some of the HR issues, we're very happy to do that, but we'll make sure that we share today's slides. We really enjoyed the conversation, Petra. Thank you so much for doing that presentation. There was a lot in, and hopefully we'll just build on that in the coming weeks. So we'll get the slides sent out to you and the recording. And thank you, Petra, particularly from everybody, and thanks to delegates for coming along. So our experiment, Petra, has worked really well. So thank you so much indeed. Thank you, everybody.
Thanks, Heather. Thank you all for listening. Thank you.
Bye.
Bye.